Protect your cognitive vitality by learning how to avoid risks. Alcohol has been a mainstay of social gatherings for millennia. Consumption rates vary worldwide according to regional norms, but in places like the US and Europe, the majority of adults consume alcohol at some point in their lives. It is widely understood that heavy drinking is harmful, but it had long been thought that light to moderate drinking was fine and potentially even beneficial. However, guidance has shifted in recent years to reflect an updated understanding of the harms of alcohol. For example, the World Health Organization states that there is no safe level of alcohol consumption. Our bodies produce very small amounts of alcohol as part of normal metabolism and can safely clear these low levels. But when levels exceed the capacity of our liver to clear it, alcohol builds up in our blood and starts to cause damage. New evidence highlights that damage to the brain and other organs can occur at lower levels of alcohol consumption than previously thought. Brain imaging studies have found that drinking the equivalent of more than 3 drinks per week can make our brains age faster. The idea that light to moderate alcohol consumption could be healthy stemmed from observational studies finding better health outcomes in people who drank alcohol, relative to those who abstained from it. We have now come to understand that this may not be a fair comparison. Many people abstain from alcohol due to underlying medical conditions, so they may be less healthy to start with. Additionally, many of these beneficial associations have been observed in populations who engage in a variety of other brain-healthy behaviors, making it hard to tease out the impact of alcohol itself. Some of the changing guidance also reflects that light to moderate drinking described in research studies is much less than people realize. Part of the confusion comes from the way the level of alcohol is measured. We typically think about alcohol in terms of volume, such as a glass of wine. But the size of a glass can vary from place to place, and the percentage of alcohol in a given drink can also vary. For example, the alcohol content of wine is most commonly around 12%, but depending on the variety, it can range from 5 to 25%. To get around this issue, researchers measure alcohol in terms of units, which equal 8 grams of pure alcohol. Light to moderate drinking is generally described as 1 to 14 units per week. Depending on the alcohol content, there are typically around 2 to 3 units per serving of wine or beer. The Lancet Commission lists alcohol consumption greater than 21 units per week as a modifiable risk factor for dementia. Because susceptibility to the negative effects of alcohol varies from person to person, it is not possible to identify a uniformly safe level of consumption. In addition to the level, the way in which alcohol is consumed also matters. Evidence suggests some patterns of alcohol consumption are safer than others. One such pattern is reflected in many Mediterranean cultures, where wine is served in moderation, at social gatherings, along with nutrient-rich foods. Many people find that a small amount of alcohol can facilitate social interactions, while drinking alone can increase the potential for harm. For most healthy adults, alcohol levels are unlikely to build up to a dangerous level when a small amount is slowly consumed over a long period of time, such as 1 serving of wine consumed over 1 to 2 hours, preferably with food, which can slow the absorption of alcohol into your system. The safest level of alcohol is none, but if you choose to drink, protect yourself and others by following the evidence-based guidelines limiting alcohol to 1 serving consumed slowly, only in the company of others, along with nutrient-rich food, no more than 3 times per week. For more information on the connection between alcohol and dementia risk, visit cognitivevitality.org.